Hello everyone, this is Lalita. I am one of the students from Wisconsin University. So this video is a part of my assignment and it is on a case study about breast cancer, and I'll quickly share the screen so that you can see what's it about. Just a minute. So breast cancer. So this is the case summary. So we have got Amara. She has been diagnosed with stage 3C invasive ductal carcinoma. It is the most common form of breast cancer. Having- so I'll just go from it again. So Amara, she has been diagnosed with stage 3C invasive and ductal carcinoma, the most common form of breast cancer. So breast cancer develops when abnormal epithelial cells lining the breast ducts, they undergo genetic mutations, which leads to uncontrolled growth and tumor formation. So normally tumor suppressor genes such as BRCA1 and BRCA2 repair damaged DNA. They regulate cell division and support apoptosis, but when these genes are mutated, DNA repair is impaired, and cancer cells may avoid apoptosis, allowing cancer cells to survive and continue proliferation. So, in Amara's case, investigations confirmed spread to the axillary lymph nodes and chest wall, indicating advanced local disease with lymphatic metastasis. So we'll go for the breast cancer risk factors. It is classified into non-modifiable risk factors and modifiable risk factors. So the non-modifiable risk factors include age, especially in older population, and gender, especially in female, and dense breast tissue, along with reproductive history such as late menopause, not breastfeeding, and a family history of breast cancer or ovarian cancer also affects or increases the possibility of having a breast cancer. And genetic mutations such as PRCA1 also significantly increases the risk. And and medical factors such as previous chest radiation therapy, LCIS, DCIS. So LCIS, it stands for Lobular Carcinoma Institute, and DCIS, it stands for Ductal Carcinoma Institute. And modifiable risk factors, they include overweight or gaining weight after menopause, physical inactivity, and alcohol consumption. So, long term use of menopause hormone therapy and oral contraceptive may also slightly increases the risk. And Amara's confirmed BRCA1 mutation is a major contributing factor. At 43 years, she is also in a higher risk age group. She reported a painless breast lump and nipple discharge prior to diagnosis. Overall, her case demonstrates how genetic mutation, disrupted apoptosis, and epithelial cell changes contribute to breast cancer development and progression. So, in Amara's case of stage 3 invasive ductal carcinoma with axillary lymph node and chest wall involvement, effective pain management is priority. So we have got nursing intervention for pain management in here. So um, her pain management is a priority because after she had cancer removal, and because cancer removal, which was a surgical treatment, and the risk of persistent post-mastectomy pain persists. So the breast cancer related pain, it can be both acute and long-term, significantly affecting quality of life and function. And in the pharmacological intervention, a key nursing intervention is the administration of opioid analgesia, which are morphine and oxycodone. So it should be administered as prescribed, and it is guided by the WHO analgesic ladder for moderate to severe cancer pain. And we have got The evidence also shows that post-mastectomy patients often experience significant acute and persistent pain, which requires opioid-based management. So in Amara's case, chest wall involvement and lymphatic spread increases the likelihood of ongoing nociceptive and possibly neuropathic pain. Nurses are responsible for administering regular and breakthrough analgesia, assessing pain using validated scales, monitoring for adverse effects such as sedation, constipation, respiratory depression to ensure safe and effective control. So another slide we have got is non-pharmacological pain management. So in this intervention, the use of therapeutic communication combined with relaxation techniques and supportive positioning is used. So evidence indicates that patients undergoing mastectomy experience not only physical pain, but also emotional distress, which require holistic therapeutic care beyond routine clinical tasks. So in Amara's case, anxiety related to advanced cancer may heighten pain perception. Deep breathing exercises, relaxation strategies, and positioning to reduce pressure on the chest wall can help decrease muscle tension and sympathetic activation, thereby reducing perceived pain and improving comfort. In Amara's case of stage 3 invasive ductal carcinoma, postoperative care following mastectomy and axillary lymph node dissection is essential due to increased risk of impaired wound healing, infection, and lymphatic complication. So effective management requires a combination of clinical wound care and therapeutic nursing support to promote optimal recovery. And so as for the postoperative wound care and management, we have got first aseptic wound care and assessment. So a primary nursing intervention is the systematic assessment of the surgical site and maintenance of aseptic wound care techniques. So post-mastectomy patients require frequent monitoring of the incision of early indicators of infection, including erythema, heat, edema, and abnormal exudate, as well as evaluation of surgical drains for patency and output. So in Amara's situation, axillary lymph node dissection further it increases the likelihood of fluid retention and delayed tissue healing. Therefore, nurses must ensure sterile dressing changes, accurate documentation of wound progression, and early identification of complication to prevent deterioration and support timely intervention. So as for the next slide, we have got therapeutic communication and emotional support. So it is required and very important during wound recovery. And it is the second priority intervention in the provision of therapeutic nursing care alongside physical wound management. So, and the evidence also highlights that recovery following mastectomy extends beyond physical healing, with many women experiencing emotional distress, altered body image, and challenges to identity. And patients have identified the importance of nurses providing reassurance and presence with caring, and it also support strategies like and also supportive strategies like active listening, validating emotional responses, normalizing feelings. It also contributes to improved coping and psychological adjustment. And it's also emphasized in qualitative findings. Effective postoperative care requires not only technical competence but also therapeutic engagement to support women's psychological recovery following breast cancer surgery. And overall, integrating aseptic wound management with therapeutic nursing care ensures holistic patient-centered recovery, addressing both the psychological and emotional need for Amara following mastectomy. So for Amara, discharge education following mastectomy and axillary lymph node dissection is essential to support safe recovery. And as for the discharge education, we have got wound care and physical recovery education. So it is to prevent complication and assist her adjust, adjusting to living with after adjustment to living with breast cancer. So education should focus on wound management, prevention of lymphedema, emotional well-being, pain control, and ongoing follow-up care. So one important policy is teaching Amara how to care for her surgical wound and drainage tubes at home. She should be advised to keep the wound clean and dry. Um, Gently pat the area after showering and avoid soaking the wound in baths until healing is complete. So, education should include recognizing signs of infection such as redness, swelling, and discharge and fever, and to report symptoms immediately. So, if drains are present, she demonstrates safe monitoring and care techniques needs to be uh, done by the person who is taking care of her or the nurses, and the ongoing wound assessment and education should be done to reduce the post-operative complications and support healing. And as for the next slide, we have got um, and next priority is preventing lymphedema and improving mobility due to axillary lymph node removal. So Amara is at increased risk of lymphatic disruption and arm swelling. She should avoid heavy lifting and vigorous activity during early recovery while gradually performing gentle shoulder and warm exercises to reduce stiffness, education, and avoiding cuts or injuries um, affected to the affected I mean like where she had the operation on. So and emotional well-being should also be addressed as women commonly experience sadness, anxiety altered by body image, and scan anxiety as well. So Frost et al., he emphasized the importance of therapeutic nursing support during recovery. Amara should be encouraged to discuss ongoing feelings of sadness or anxiety with her GP, breast care nurse, or counselor, or psychological support and counseling services. They may provide improve coping that may improve coping and recovery. And multidisciplinary support is essential and should involve the breast care nurse, surgeon, oncologist, physiotherapist, GP, and lymphedema specialist. So ongoing follow-up apero appointments every 3 to 6 months are also important to monitor recovery, manage long-term side effects, and detect recurrence early. So as um, all the references are here, all informations were um, paraphrased from all of these resources. And thank you so much. Let's cut the video now. Stop sharing.